a little bit more about this whole public policy, what's going on right now with the state and these grants to get more people working in rural hospitals, in rural communities.
Well, there are a lot of different organizations around the state that focus on building the healthcare workforce. And what the Workforce Policy Collaborative has provided us with is a forum for all of those organizations to come together and to really talk about what the issues are and to try to make policy recommendations to address those issues.
So I don't really understand, what do you mean? What are these issues? What are the issues that are a concern?
Well, currently we have we basically are in crisis, especially in our rural communities. We have a tremendous shortage of healthcare professionals across the state currently. If current trends continue, we will have an even greater shortage in the next 5 to 10 years. Our population is aging, and that means that our health professions workforce is aging as well. We have a large percentage of health professionals that are moving toward retirement and who will be leaving practice and will no longer be serving in the communities where they reside. On the other hand, we don't have the pipeline equipped to produce the health professionals that we're going to need to take the place of those retiring doctors and nurses and physician assistants. So we need to be building our pipeline and thinking about the future, but at the same time we need to be recruiting and retaining for health professionals today.
And are you talking about mostly in rural communities or everywhere around the state?
We have health professional shortage areas across our state in urban and rural areas. It's very difficult to recruit and retain health professionals in communities in urban areas where you have low-income populations, a high percentage of low-income population, because those communities don't often have private insurance coverage or the funding to pay for access to health care. So we have shortages in urban areas, but those issues are exacerbated in rural communities because it is very difficult to convince a new graduate out of a nursing program or out of medical school to move to an isolated rural community with their family to set up a practice.
Well, I sort of understand that. I mean, why would they want to go to those small communities? What's their incentive?
It's difficult to convince them unless you have an incentive. And one of the greatest incentives we have today is our loan repayment programs. We have 5 loan repayment programs in Colorado. And medical students are getting out of training with about $150,000 to $200,000 in loan debt. And so these programs provide them with funding to help pay back their student loans in exchange for a commitment of 2 to 3 years of service in an underserved area.
So tell me more about, you said we're at a crisis situation of sorts. Paint a picture about what this means for the type of care, medical care, that people in these rural communities are getting right now or could get down the road.
I'll give you an example. The town of Eads, which is on the eastern plains of our state, has been trying to recruit a family physician to that community for about 2 years now. It's very difficult to recruit to that community because it's a very small community and they don't have a lot of cultural amenities, they don't have a lot of employment opportunities. These days, physicians are married to spouses who are also professionals, and we need to find professional employment for them as well. And that's very difficult in a small rural community. If you're not a teacher or a healthcare professional, there really isn't a professional job for you. So it's been very difficult to recruit a physician to that community. The result of that is that the residents who live in Eads and in Kiowa County have to travel up to 200 miles to access healthcare services. They have basic primary care services available at the local community because there is a small hospital in the community. The hospital has less than 10 beds. They provide basic primary care, but they don't provide any specialty care. They do not do obstetrics. And so if you're a young woman living in the community and you would like to have a family, you know up front that you're going to have to travel out of town, most likely to Colorado Springs, and reside there around the due date so that you can deliver your baby, because you can't do that at the local community level. Additionally, if you have an emergency, some kind of trauma, which is very common in rural areas due to the agricultural environment, we also have